Good evening. Welcome to the 137th day of Swasthya 365 Plus. Today, we will be dealing with cognitive disorders. Cognitive disorders, also known as neurocognitive disorders, are a category of mental health disorders that primarily affect the cognitive abilities such as learning, memory, perception, problem solving, and language. There are four major types of cognitive disorders. First is delirium, a change in consciousness that develops over a short period of time in which people have a reduced awareness of their environment. The next is dementia, a progressive deterioration of the brain function that is marked by impairment of memory, confusion, and inability to concentrate. The next is amnesia, a significant loss of memory despite no loss of other cognitive functions like there is in dementia. The next is mild and major neurocognitive disorders. This is due to impairment due to a general medical condition, genetics, stroke, etc. Apart from these, some other cognitive disorders are developmental disorders, motor skill disorders, and substance induced disorders. In these disorders, the patients are no longer fully oriented to time and space. Depending on the cause, the diagnosis of a cognitive disorder may be temporary or progressive. For example, delirium is temporary, whereas dementia, like Alzheimer's disease, is generally progressive and unrelenting. All cognitive disorders may be caused by some disease. The treatment of each depends on a specific diagnosis, but in all cases, the treatments are not curative. Instead, the treatments are designed to minimize the patient's symptoms. Well, the next logical question is what are the causes of cognitive disorders? Like most mental disorders, cognitive disorders are caused by a variety of factors. Some are due to hormonal imbalances in the womb, others may be genetically oriented, while still others may be due to environmental factors like lack of proper nutrients and interaction during vulnerable stages of cognitive development, particularly during infancy. Other common causes include physical injury, abuse in certain areas of the brain that determine cognitive functions. Now that we know the causes, let us look at the symptoms. The symptoms may vary according to the particular disorder, but common signs and symptoms overlap in most disorders. They include confusion, loss of short term or long term memory, poor motor coordination, identity confusion, impaired judgment. In most disorders, the signs increase in severity with the progress of the disease. Alzheimer's disease, for example, begins with a patient showing very minor signs of forgetfulness, like forgetting the names they know well or having trouble remembering what they did recently. All these may pass off as normal memory errors. However, with the progress of the disease, the affected person's memory becomes persistently impaired. They may have rare moments of clarity, but life is generally lived in a state of confusion. The most common of all symptoms is the emotional imbalance that the patient undergoes. In most cases, these symptoms become frustrating and unmanageable. The patient may have emotional outbursts or may attempt to isolate themselves or may have reverse effects such as dull and non existent emotions. All these make it difficult for the family and friends to help. Well, the cognitive disorders unfortunately affect the person physically as well. Most of the patients appear dazed and confused, and their eyes may have a glazed appearance. Motor coordination is often affected in both neurological and physiological cognitive disorders. This may result in a person having unusual mannerisms or simply a lack of balance and normal posture. Luckily, these disorders have some short term effects such as memory loss, a state of confusion, and lack of coordination. But they have some long term effects too, which include loss of declarative memory, such as forgetting names, significant faces, lack of emotional stability, and control over one's actions. A person with the above symptoms has to be definitely examined by a doctor before they are put on to any treatment plan. Self medication or examination is not advisable. and the patient needs to be handled gently with the help of counseling. The next question is, can these diseases be cured, and are there effective medications to help the affected people? Well, fortunately, medicines are available for this disease, but unfortunately, most of the cognitive disorders cannot be cured permanently. The medicines have the capacity to make the life better and improve the quality of life by reducing the effects of the symptoms. They help to reduce memory loss and improve cognitive functions. Most of the drugs belong to the antidepressant family and should be taken according to the physician's prescription. Well, most of the drugs come with side effects such as drowsiness, insomnia, and upset stomach. The physician is the right person to advise on the treatment as it depends on many factors and the patient's body conditions as well. People suffering from such cognitive disorders will mostly appear normal, but their temperaments will not let them lead a normal life. So please identify such people and take them to a doctor for complete medical assessment. Please take care of them and treat them with compassion, as their actions are done without their knowledge. An early detection of the disease will help not only the affected person but also the people around them. A stitch in time saves nine. So please act fast and act sensibly. Let happiness prevail always. Wishing you all a very happy Diwali. Stay safe and stay healthy.